Thanks for joining. So I think I'm good to go as well on TikTok. Okie dokie. Thanks for joining, guys. Thanks for joining. So how have you been? How is the weather around your area, guys? Hi, Chibere. Eze. How are you doing? I've not seen you for 2 days. How I hope you're keeping well. Chidebere, did you manage to fix your phone? Or not yet? How do I even send? He's sending his greetings. Your son Farouk. I'm not seeing Farouk for a while. Chidebere, why is your name looks like an Igbo name? Chidi. Yeah, Chidebere Umwaizi. Oh my god, that's a lovely name. Very lovely name. So Chidebere, are you Igbo? Because I know Farouk is in Taraba State. Hello, thanks for joining, guys. Just on TikTok. Thanks for joining. Hi, Dr. Miracle. Thanks for joining. Hello, Anna. Hello, Matoke. Thanks for joining. So if you're on TikTok, feel free. My life goal is on. Feel free. Follow yourselves, okay? NHS. Hello, babe. I dey do live video. I beg. 2 hours time, okay? Bye. Bye. So today we're gonna be talking about chest pain, guys. So not available. Oh, so I think I've managed to get TikTok up and running. Speaker not available. Microphone not available. To go live self, like homework. I have to plan 1 hour in advance. So those on TikTok, can you hear me? It says microphone not available. Open audio setting to check. Microphone not available again. If you can't hear me on TikTok, please just indicate in the comment section. If you can hear me, just put thumbs up, please. Okay, so we can go ahead. So sound is 90%. Speaker is on. No, speaker is on. So TikTok, if you want to join, feel free. If you want to come on the box, feel free. Okay, just indicate and I'll bring you on the box. You can always chat as well. Okay, just an interactive section. All right. So I think that's Facebook. Yeah. So those on Facebook, you're really, really active. Thank you so much. I really appreciate all your support. Okay. Chidebere, Francis, you guys are amazing. I really appreciate all of you. Without you guys, I will not be here today. Okay. I really appreciate God Almighty will bless you people. Okay. I don't have silver and gold to give you people, but I promise myself whatever I have, I'll be able to provide. Anything I can provide within me, I will. You've been amazing. You've been supporting me. And God Almighty will bless you. And God will bring people that will also keep blessing you as well and supporting you in this life. Okay. Thank you. So we're just going to go quickly straight ahead to why we are here today. So today we are here to briefly talk about chest pain. So a lot of us experience chest pain and we really don't know why we're having chest pain. And some people just ignore it. And then some people just feel, oh, when I lie down, if I have a chest pain, if I lie down, it will be okay. Or if I sleep one side, the chest will be okay, the pain will go. Oluwatu saying hi. Thanks for joining. So some people feel if they drink cold milk or cold water, the chest pain will just disappear. So before you have chest pain, it is common. It will not just happen on its own. Chest pain will call for a particular reason, and that is why you need to pay important attention to your body. When I mean your body, you need to be very, very proactive to be able to know when. I don't know if I'm audible enough. I'm not Even prepare for today's life, honestly. I forgot to put my microphone on. Well, let me do video with no even ready. I'm not even prepare for anything, safe. I just carry myself consider for you. Sorry, guys. Today I really lack preparation. This is not like me, honestly. On a normal day, I did prepare well, you understand? So, but today, I don't know. Sorry, guys. On a normal day, I prepare really well, but for some reasons, today, I haven't prepared. My mic is not even working, safe. It's didn't charge. Huh? Oh boy. See who won't do life. I don't even prepare safe. I just consider for you like monument. Sorry, guys. Sorry, guys. Oh, so this one is working. Perfect. So one of my mic is working, which is good. So I will put that here. Let me turn around. Hello. I hope the battery doesn't run down because that one is on, but this one is not on. So I will put this on charge. Yeah. Thanks for joining, guys. So today we're gonna be quickly talking about um we're gonna quickly talk about chest pain, guys. So what is chest pain and why do we need to pay attention to if we have chest pain, why do we really need to pay huge attention to it? So in this video, I'm going to tell you all that you need to know. Okay, I'll put that one here, then I'll charge it. See how it charges. So sorry, let me put my mic on charge, okay? So I don't come back again next week and start looking for mic that is not properly charged. Oh boy, no be small thing. The kind of cable wey dey this house, you don't reach to carry go open fire factory. I'm telling you. So I'm just charging my, yeah, it's on charge now. Since I bought this mic, you won't believe it. This is the first time I'm charging it. Still want to do content, though. I'm not even prepare. Not send person, Papa. I do content. I need to charge mic because my voice and microphone. So, guys, so we're talking about chest pain today. So, one thing I need to remind you is, have you ever felt a sudden pain in your chest and for a split second imagine the worst? If the answer is yes, then this video is for you. Okay, if you can't stay till the end, it's going to be about an hour live section. But if you cannot stay till for an hour, you can feel free hop back in and out, or you can watch the video later. The video is going to be made available online for 30 days before it gets deleted. So I've done scenarios, I've done videos, AI assisted videos on chest pain. So you can go back and watch those ones as well if you want. But then sometimes, like I said, have you ever felt a second, a sudden pain in your chest, or for a second felt imagining the worst? For most of us, the answer is going to be yes. So maybe it lasted for a few seconds, maybe it was a burning feeling after a meal, maybe it happened during stress, or maybe you may have ignored it, or maybe you worried quietly and told no one. But regardless what it is, chest pain has to do with the chest, has to do with the heart. So chest pain is one of the few symptoms that can stop a conversation instantly if you feel if it occurs when you are having a conversation. And it has the power to turn chest pain has the power to turn a normal day into a moment of fear. Strong people feel vulnerable, and then confident people feel uncertain. And then the biggest question appears in the mind almost immediately: is this my heart? So that is why you don't just see chest pain and ignore it. So for me, when I see chest pain, initially before I came to the health sector, I see chest pain as maybe indigestion or maybe something, but I don't really attribute it to the heart. I would just like maybe take cold drink or reposition myself or just remain calm for a while and it will just offset. You understand? But then when these things are becoming repetitive, becoming common, you need to take it seriously. Regardless what you do in this life, like I said in one of my videos, Everybody has got one health diagnosis or the other. You may have known yours now, or you don't know, but then everybody has one thing somewhere. So that is why it's very important you don't overlook um things like this. Just are you there? You know, it's downstairs. So it's very, very important to don't ignore red flags. So today we are going to replace fear with understanding, and that is why I've made this video so that you can see chest pain uh, the way it is in real time, rather than having that unnecessary fear. Okay, so because chest pain is not a diagnosis, chest pain is a message. So when you have a chest pain, there is no diagnosis, it's just a message, that a signal that is the brain has sent to your um, has sent to you that you have so and so pain in your chest. So it is your body raising its hands and saying, "Pay attention to me," and that is the reason why you really need to pay attention when you have chest pain. The truth is simple and surprisingly, at the same time, most chest pain is not caused by a heart attack. That is one thing you need to understand. So when you have chest pain, don't just say, "Oh, my heart is failing." No. Hi, Florentina. Thanks for joining. I appreciate you. Thank you. So when you have a chest pain, don't just think it's heart attack. But the reason we must understand it is because some chest pain absolutely can be life threatening, and that is why a lot of people are scared. So the challenge is learning the difference between danger and comfort. So when I mean danger and comfort, I will specificate what I mean. So say for example, between urgency and anxiety. Urgency simply means you need to reach, like, right now, taking it seriously. I will see it as a life-threatening something. Then anxiety is you're panicking. So that is the two difference there. So hi, thanks for joining. For those who are joining, we're just talking about chest pain, how to identify what is chest pain, how to identify chest pain, and hi, Dr. Charisma, Chris Max. Thanks for joining. So the oh, actually, very I think your puzzle. That's fear. Oh, that's a nice one. So we are just talking about chest pain, causes of chest pain, and treatment for chest pain. Hi, still very nice. Thanks for joining me. I appreciate you. So, having said that, we also need to understand that not everything that has to do with chest pain that is heart attack. The chest is like a crowded apartment building. Many important organs live there. So the heart, the lungs, and the food pipe, the muscles, the ribs, the nerves, and even the mind have a voice in this space. When pain appears, we must identify who is speaking within that zone. So, like I said, oh my God, I don't know why people will be making calling you when you're doing live video. I know, just understand honestly. So, one of the most important truth is that chest pain is a symptom, not a disease. It is a signal, and like any signal, it can come from different sources. So that's why it's very, very important you pay attention. So the cause people fear most is the heart. People fear the heart. The reason why people fear the heart, because a lot of people feel, or if I'm having repeated chest pain, it could be heart attack or TIA, or to have stroke in the process. Yes, they are right, and they know they are not right. So the answer is variable. It depends on it depends.
This is a stark contrast to the clear blue sky above. A sense of quiet hope permeates the scene, a promise of
Sorry,
brighter
guys.
days ahead. The park is alive with the quiet energy of new beginnings and endless possibilities.
Sorry,
Night
guys. Let me
blankets the
mute
apartment,
this.
casting a soft glow on the desk. I sit, the room quiet, a sense of deep contentment washing over me. A gentle smile plays on my lips, reflecting a feeling of fulfillment. The night air is still as I pause, savoring this moment of peace. The
Sorry,
laptop
guys.
screen dims, the room fades. Darkness descends as the lights are switched off. Silence fills the room. A moment of quiet
Sorry, I'm trying
contemplation.
to pause
Inside the apartment,
my
the city lights
live on
glitter
YouTube.
like scattered diamonds, reflecting softly in her eyes. A soft smile graces her lips as she gazes out at the sprawling cityscape. A wave of gratitude washes over her, warming her heart. She cherishes the connection she's forged, each one a beacon in the urban night. The city offers endless opportunities, and she is ready to embrace them all. Silence hangs heavy in the apartment, a palpable weight pressing down. I am alone, the quiet amplifying my solitude. My gaze sweeps across the room, taking in every detail. A deep breath trembles from my lips, breaking the stillness. The silence seems to mock me.
Sorry, guys, I'm just trying to pause this video. What a carry
We're
on.
all in this together.
Finally, I've paused it. My computer is so slow. My desktop is so slow. It's a brand new desktop, and it's just very slow. Sorry, guys. That was sorry for the sorry. So for those that are joining, thanks for joining, Augustina. Thanks for joining. And for those that are joining just now, we are talking about chest pain, the causes of chest pain, and then the treatment for chest pain. So when you have chest pain, please, guys, do not panic. Please do not panic, and don't forget, do not ignore when you have chest pain. Very, very important. Do not ignore when you have chest pain. Please, very, very important. So, one of the most important truths is to understand is that chest pain is a symptom and it's not a disease, it's a signal. And like any signal, it can come from many different sources. So, the cause people fear most is the heart, and with good reasons, obviously. But when the heart muscle loses its blood supply, every minute matters. A heart attack happens when the blood vessels supplying the heart becomes blocked. Oxygen cannot reach the heart muscles, and the heart begins to suffer, and if untreated, begins to die. So you and I know that once the blood is not does not transmit oxygenated blood to the brain, automatically after a certain minutes, the brain cells begin to die. So that is why it is very, very common for you to have a chest pain if something is not right within your system and the anatomy of your body. I've just put an image I posted yesterday. If you go through the anatomy of the body, you can tell exactly where your chest is, where your kidney, where your liver is, and where your brain is as well. So automatically, when there's a shortage of blood supply or your pipes have been narrowed, like in the case of pulmonary fibrosis patient, so you find out that if blood is not circulating properly and deoxygenated blood and oxygenated blood are not going the right way they should go, obviously there's something that is going to be affecting, and those things is going to be affecting at the organs of the body. And those are the organs of the body. You have the heart there, you have the kidney, you have the liver, you have so many other organs there that lives within the neighborhood there. So that's why you really don't have to ignore any form of pain, regardless how mild the pain might be. So, and you don't just see pain and just go and take paracetamol all the time. Remember, long term overuse of paracetamol, especially ibuprofen and paracetamol, have got issues as well. So that is why if you really want to keep your liver safe, for me, I don't take paracetamol. I take paracetamol. Don't not as if I don't take it. I do take it, but I only take it on a severe occasion. Honestly, I don't take it as a routine medication that if I'm in pain, I just take it. No. So that is why you really need to understand what you're doing and how important looking for a volunteer for good goals. So you need to understand how you look after your body and respond to red flags when your body signals something. Try to be very, very alert and try not to ignore unnecessary things. So, like I said, not every pain has to do with chest pain has to do with heart disease. So, and not all heart-related chest pain is heart attack. Sometimes the heart sends a warning signal before a major event occurs. So, this warning is called angina. So, angina happens when the heart receives less blood than it needs during times of increased demand. Okay, so imagine traffic during rush hour. Cars can still move, but slowly with difficulty. So during exercise, stress, or strong emotions, the heart works harder and requires more energy, oxygen. So if the blood supplies cannot keep up, pain appears. So that is why for people that are athletes, when they are exercising, say when they are doing their practice, and then they find out that they're having pain, they sit down instantly. Some of them do so just to make sure they relax the body, they're not putting more effort, because the more exercise if you ignore the pain and you're doing continue with the exercise, the body still need more demand of oxygen to be able to go around what activity you're actually doing. So that's why some of them they just quietly just sit down quickly to just gain that momentum and have that peace. So it's very important to understand during exercise, stress or strong emotions, the heart works harder and requires more oxygen. So if the blood supply cannot keep up, then pain begins to appear. So that's one of the causes of how you can have chest pain in the form of angina. So angina usually improves with rest. That's why I said those athletes sometimes they rest. When they notice that pain, they just rest and it helps. So when the demand decreases, the discomfort fades away. So that is why if you're doing an active exercise and you experience that chest pain, the first remedy you need to do is to just leave the exercise you're doing and just rest. Once you rest, obviously you're not doing any physical activities that requires more oxygen to do that task. Automatically, as you're resting, the force you're using to do whatever will relax as well. Obviously, you're not doing any active exercise at the time, and then the discomfort you have in your chest cavity automatically will reduce. So that is the quickest way to treat chest pain if you're having chest pain. But don't forget, regardless what you do, you need to seek cons- um seek support from your GP as well. Like I said, chest pain is not something you just overlook or ignore and feel all is right. No. Then also angina usually improves with rest, like I said, and when the demand increases, the discomfort fades away. So this is the body's early warning system. So asking for attention before a crisis develops. So when you're doing your exercise and that pain appears, immediately ignore it and sit down. Don't ignore it. Just sit down and have a rest. So that is your body telling you signal. But if you that's your body giving you that warning that see this chest pain is not just ordinary. It's because the oxygen supply for the activity you're doing doesn't really match. So you are doing more exercise than the body actually oxygen is being supplied. So you need to rest. If you do not rest, that can lead to something else, unfortunately. That is why that's the first thing you need to do. When you're having chest pain, just remain calm. Everything you're doing can pause. Just wait, relax, have a good, I just rest. And before you know it, that discomfort will just go away. Very, very important. So there's also a condition called pericarditis. So for those of you that are more conversant with the anatomy of the body, this is when there's inflammation of the thin sac surrounding the heart. You know, this heart is like a love shape, with the pump, the aorta pump facing out, the pulmonary veins and all that, the pipes leading out. So um, the sac surrounding the love-shaped heart. So it's called a pericarditis, and it is inflammation of the thin sac surrounding the heart. So that is another factor that can cause pain. And the pain here is often sharp and changes with position. So lying flat will worsen it. That's if you're lying flat. When I mean lying flat, you're lying flat. Can worsen the pain in some cases. While sitting forward may bring relief. So if you sit like this, you're sitting straight up, you're sitting forward like this. So that can give you some relief. So even simple change in position can give doctor important clue about the source of the pain. Say for example, you've gone to see your doctor regarding your chest pain, and your GP will tell you, okay, roll on your side, experience the pain, and you go on this side, you're not experiencing it. By the time they do their physical examination, they can tell you the position of the pain. And that is why when you go for a consultation with any of your GPs or AMPs or paramedics, they will ask you, you're presented with chest pain, which is understandable. They will ask you, are you in pain any other place? They will ask you the sites where you're having the pain, and then they will ask you the characteristics of the pain. Then onset simply means the pain. Is it a fresh pain, or is it a pain that has been there or is been recurrent? So in your case, it's going to be a new pain. So they'll ask you those questions. Then any associated symptoms like any fever, if you're having this kind of pain, do you have fever? Do you have nausea? Do you feel dizzy? So they ask you all these things, and then they'll ask you to scale it within a scale of 10 as the highest pain and 1 as the zero pain. How painful is your pain? You'll be able to tell. And then all this is give an indication to know how location of the pain, how the pain is, does the pain radiate, there's an exacerbation, does the pain radiate to other parts of the like your shoulder blade, your left or right shoulder blade, and then so these are the things they look out for, and then the kind of examination you do when you are doing this. Sometimes you go with chest pain, and upon examination, you can find out that there's other things wrong as well. So going with chest pain at the end of the it, when they do all their physical examination and come to a differential diagnosis, it may end up being that you're having shortness of breath, or you just have angina or COPD or asthma. So it can come with different form. So that is, and then they can start a plan for you. And the examination they will do is full of situation because it's got to do with your chest pain and the breathing pattern. They will be doing what they call respiratory examination. So it's very, very important you listen to cues, get all the details, facts right. So when you're handing it over to your GP, you're giving your GP the accurate information about what is actually wrong with you. So they can go through that step by step systematic guide to be able to ascertain what exactly the issue is and then the treatment plan for you. Okay, so it's very, very important to pay attention to your body. Really, really important, honestly. So, but the heart is not the only organ capable of creating chest pain. That's one thing you need to understand. And then the lungs play a major role as well. One of the most serious lung-related causes is the pulmonary embolism. So, in this situation, you also know that the heart is not the chest pain is not the only thing. Hi, Sir Trading. Hi, Rufak. Hi, Hamid. Oh my God, the names are so difficult to pronounce, honestly. So, like I said, the heart is not the only organ capable of creating chest pain. So, the lung plays a major role as well. And then, not just the lungs, one of the most serious lung related causes is a pulmonary embolism, a blood clot that travels to the lung. All diseases can cause chest pain as well. So, that is why a proper examination is really, really important to ascertain the actual cause. So, this type of chest pain is often sudden and sharp and then breathing becomes difficult. So you see now you're having chest pain, but you're coming to see your GP. It's affecting your breathing. So that is why as associated symptoms. So you have SOB at the same time you're having chest pain. So it's very, very so one thing can lead to another. So that's why you need to understand that chest pain is not just only caused by one thing. Okay, so the heart is not the only organ that is capable of creating chest pain. There are other organs around the neighborhood there that can actually create chest pain, just like I said, the lungs as well. So you need to understand. So this type of pain is often sharp and sudden. So breathing becomes difficult, and then the heart races. So it can happen after a long period of immobility, such as long flight, surgeries, or extended bed rest. So for those that have had what's it called surgeries and extended bed rest, like basically if you had surgery, put surgery because if you're going to be in bed for a long time, say, for example, you've had a femur fracture and you have to go through, or you've had hip replacement, and then you're going to be in bed rest for like a period of 2 weeks. So mostly sensible for you to be prescribed blood thinners, like you get prescribed dataparin or enoxaparin. That keeps these are blood thinning medications that keep your blood protects you from blood clots because obviously you are immobile, you're on bed rest for the period that you're recovering. So it's very, very important. Hi, Fatu. Thanks for joining. Thanks for joining. Thanks for joining. I really appreciate all your stars, guys. For those on TikTok, my life goal is there. Support me with stars, please, if you can. Okay. And I bought my heartmate there as well. Please, if you can support me, that would be great. Thank you so much. I appreciate it. You can follow yourself as well, okay? It's just a small community we're trying to build. So we'll get there. Just show yourself some love by following yourselves. Thank you. Thanks for joining. So So now, having said that, guys, you need to also understand that infections of the lung can also cause chest pain. Say, for example, you've got pneumonia, and inflammation of the lungs lining can make breathing painful. So every breath becomes a reminder that the lungs are irritated and inflamed, and they're not like heart pain. This discomfort often worsen when taking deep breaths and or coughing. Sometimes cough alone causes chest pain as well. So you're coughing, 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 coughing. Hi, thanks for joining. Thanks for joining. Still a brain rot pro. Wow, what a long day. Lovely. Thanks for joining. So, but surprisingly, many cases of chest pain begin in the digestive system. So you all know that we have the four stages in digestive system. So if you've gone through the image I posted about 2 days ago about the anatomy of the body, you can see where the digestive system is. So that's exactly what the human body looks like. So when you're having pain on this other side, you can easily tell that, oh, could this be appendectomy or could this be this? If you're having pain on this side, you can say, oh, could it be my liver is inflamed or my right kidney is. So the anatomy is good for everybody to have in their mobile phone. So when you have pain, you look at the anatomy of the human body and then you can basically tell. So the doctors, they are not magicians, to be honest. They have studied it so well that they know, and they make reference to the BMF as well, and they make reference to they still read, they still do researches as well. So if you have this anatomy and understand your body system, you should be able to tell that, oh, this thing I'm having, it could be either this, or this. You know what? Let me stand up. I'm going to see a doctor just now. So you can literally provide, go seek help in the first instance at the early stage before things become too complicated. So why are we doing this health talk? We're talking about doing this health talk because, like I said, regardless what niche you are, if you're on this if you're on social media, regardless the niche you are, you need to be physically and medically fit for you to even come online and do whatever business you're doing. Whether you're an influencer, you are a blogger, you are a content creator, or you are anything on this online space, whatever you're doing that gives you joy or money or resources, happiness, you need to be medically fit. And that is why I said this channel is really good because we have various, sometimes I go off record and go off record to drop off other funny talks, motivational talks and stuff. But then the main aim of the channel is to provide health talk because everybody needs it. If something is wrong with you, you can quickly go and say, "Oh, pain management. What medication can I take for my pain?" You can go and watch those videos and come back and educate yourself. What homely remedies do I need? Oh, I've not moved my body for 7 days. What do I do? So you are not panicking. Everything you need is on the channel. You just go watch the video, apply it, and get tips and see what you can do there before you go and seek help from your GP. So you're not wasting unnecessary money and you're not panicking unnecessarily. So very, very important. Like I said, surprisingly, many causes of the many cases of chest pain begins in the digestive system. So the esophagus, like you all know, the tube carrying the food from the mouth to the stomach, sits directly behind the heart. So if you go through the anatomy image I posted, you can see where the esophagus is. It's sitting next to the heart. And it's so funny because when stomach acid flows backward into the esophagus, it creates a burning sensation commonly called heartburn. So that is why like for me, if I eat beans, I have heartburn. I know about that. So I eat beans though, but I eat it like maybe once or more, twice or sometimes whatever. But then it's not something I will eat regularly because whenever I eat beans, I have heartburn. You understand? I've got peptide that I take, Gaviscon, that I take to relieve the symptom, or rather taking medication to relieve the symptom of heartburn. I can actually recognize the food that makes me to have that heartburn. So I don't know if you understand what I mean. I rather treat the causes. Why am I having this heartburn? I'm having this heartburn because when I eat beans with excessive spices in it, like chili spices in it, I get heartburn. So I'd rather make my beans. I don't eat beans all the time, and when I'm eating beans, I don't put spices in it. So I can eat it comfortably and enjoy it. So when you treat the cause of any diagnosis, you will not have any need to go to hospital. It's just as basic as that. So if you know what the cause of that particular thing is, you don't do it. If you don't do it, then you just like you having regular constipation. You're having constipation, you're not drinking water, you're not hydrated, you are not taking fruit. Obviously, you will be constipated. You're eating carbohydrate in the morning, afternoon, evening. Obviously, you're going to be constipated. You're not drinking enough water to keep yourself hydrated. So everything is just piled up there. So rather than going to buy laxatives all the time, Senna or whatever, or Docusat or Cosmoco, laxatives to treat constipation, why don't you rather treat the constipation, fight the cause? Why am I always having constipation? I'm having constipation because I am not drinking enough water. So, oh yeah, let me start drinking water every day properly. And also, let me be taking fruits, at least 5 fruits in a day, something. So it keeps your system going. Then by the time you know it, you've rectified the constipation and you never have any reason to go and buy laxatives and keep in your house. So it's as simple as that. Understand your body system. Don't wait until things go wrong for you. You start running helter skelter. That is number one. Somebody sent comment. Let me just reply to this comment. Hello. This people on TikTok. They don't sleep. They're always on TikTok. Yeah, I'll respond to your question shortly, darling. So we're talking about chest pain here, guys, and then the causes of chest pain, and then what you can do, and we're giving other illustrations as well. So, like we said, the esophagus is some of the cases of chest pain begins in the digestive system. So, and we're going to talk about the esophagus. Esophagus is the part that carries food through your mouth to your system to your stomach where digestion takes place. So obviously the pipe is next to the heart as well. So the esophagus is to carry the food from your mouth to the stomach sits behind directly behind the heart. So when stomach acid flows backward, stomach acid, you know what stomach acid for those that do pH forever, pH level. If you know what stomach acids are, so if your stomach acid flows backward into the esophagus, it creates a burning sensation commonly called the heartburn. The name itself causes confusion, and it's understandable that heartburn has nothing to do with the heart. Don't get it please. Heartburn has nothing to do with your heart. It's just acid reflux in your stomach that move backwards into your stomach and have caused burning sensation and irritation. That's all. That is what causes heartburn. So don't let anybody deceive you that if you've got heartburn means that your heart is burning. That's not true. Please, that is just not true. Okay. So don't just get unnecessarily frightened. Heartburn has nothing to do with heart. Yet the sensation is felt in the chest and can be intense enough to cause fear. So that is why if you know what's causing you that heartburn, please, if it's food, devise a different means of that food. Don't even stress yourself anymore. Okay? Very, very important. Acid reflux often appears after meal, especially large or spicy meals. Like I said, when I'm eating beans with spicy ingredients, I get heartburn. Okay, so acid reflux often appears after meals, especially large or spicy meal. Lying down can worsen it because obviously you need to be upright for the food as the food is digesting, you need to remain upright. Okay, you can't just eat and just go and lie down. Obviously, you're going to cause more harm to yourself than good. So your weight matters, your diet, and the timing of the meal all plays important role. So if you're the type that is obese and then you just finish your eat, you go and lie down, the type of diet you've had is it spicy? Then and the timing of the meal, is it midnight or is it off peak evenings you have the meal? And then maybe say for example you've had the spicy beans with spicy ingredients, all hot at 10 p.m. And then by 20 past 10, you are lying down. Obviously, you could cause problems for yourself. It's very, very important. It's just a common sense. Look after yourself. Okay? So it's not something that somebody will need to remind you to do. Something as simple as eating late at night can lead to chest discomfort hours later. Like I said, I just said 10 p.m. So you need to understand that even when you're eating, you need to be mindful of the time you're eating your last meal of the day. Very, very important. So you don't create unnecessary discomfort for yourself hours later. Another thing we need to understand is the esophagus can pain. So the ribs connect to the breastbone through cartilage, and this cartilage can become inflamed. When these are inflamed, this condition is mostly common when you've got ongoing issues going on, and sometimes it can be a one-off something. Okay, so it's very, very important that you are able to differentiate what is causing this particular chest pain. Is it being caused because I've spicy meal that in form of that has caused me chest heartburn that is being reflected in form of a chest pain? So is it lung related, or is it has it got something actually to do with my heart not receiving enough oxygen to do is or tax required tax? So you need to be able to differentiate it. So that is why you don't just have heart chest pain and panic. Please try not to panic. Very, very important. Try not to panic. It is very, very important. Try not to panic. You are the best person for yourself, because if you allow panic to eat you up, bet me you will never you will just I don't know, you will just find yourself slowly, and that is not what anybody wants. So you need to be informed about what is going on in your body, and then know what to expect, and then try to work towards it. Because of this similarity, doctors always rule out heart causes first before settling on digestive explanation. So, because the heart is so delicate, every human organ is delicate, is important. But because the heart is delicate, when you go for a consultation section, they want to rule out anything that has to do with the heart first. So, say for example, your vital signs are okay, your blood pressure, your systolic and your diastolic is okay. Every other factors that will suggest heart-related problem is okay. Then they will rule that out first. They need to rule that out first. Then that gives even the doctor and yourself peace. Then they cannot talk about your digestive system. So that one at least is more linear. It's not as severe as the heart. Okay. So for example, somebody telling you you have heart attack. Obviously, that one is more powerful than somebody telling you, oh, your digestive system is not working properly, or there's something wrong with your digestive system. That one can be all of them. No one is good, I know, but then that one digestive system at least can be more is easily treatable. If I may use that word. So very, very important. Understand your body and try not to create unnecessary fear and tension for yourself. Absolutely not needed. Absolutely not needed. Hi, thanks for joining. So very, very important. You look after yourself, like I said. So the muscles and the bones of the chest wall are another common source of chest pain. Say, for example, the ribs connect to the chest breastbone through cartilage, which I've just said. So that can cause chest pain. So if pressing on the chest produces pain. So if the bone is pressing on the chest produces pain, obviously, and that is why you need to understand what pain. Then the cause is often muscular. I don't know. The cause is often muscular rather than cardiac. So when you see a muscle pain, you should be able to identify and be able to differentiate it from cardiac pain. So that is why, like I said, they're doing your diagnosis. They have to first of all rule out the chest beat out, the heart beat out before they go to other sectors to check what is actually wrong with you. So very, very important to, like I said, I don't know how best to emphasize, but you need to really listen to your signal. When your body gives you signal, don't please ignore it. Please do not ignore it. It's very, very important. Please, you don't ignore it. So this type of pain, while uncomfortable, is not life-threatening and usually includes rest and inflammatory treatment. So then there is a cause many people hesitate to discuss, and then that one is called anxiety. Like I said, if you watch me from the beginning of this video, I keep saying try not to worry, try not to worry, try not to worry. The reason I said try not to worry is because anxiety and panic can cause pain as well. I know some people will say, how? Yes, I will explain. The connection between the mind and the body is powerful. That's one thing you need to understand. So during anxiety, the body activates its fight and flight response. So the heart beats faster and breathing becomes rapid and shallow. So then the muscles tightens and the chest can feel tight, heavy, or painful. The experience is real, physical, and frightening, even though the cause is just emotional. You can imagine, so you just having anxiety, you've created a lot of tension for yourself. Sorry, guys, let me just put the my washing machine is making a whole lot of noise. Hi, guys, sorry. Okay, okay, so let's start again, guys. So, sorry, guys, I had to go and switch off all this, all those things in the kitchen making no noise. So, for those that have just joined, we are talking about chest pain. The causes of chest pain. the treatment for chest pain. So we talked about that not every chest pain has to be with the heart. That sometimes some of them can be caused by the lungs. Sometimes the food pipe, the esophagus that carries food from the mouth to stomach for digestion to take place is the pipe, the tube is just behind the heart. So when the reflux goes backward, it goes backward and causes burning sensation, and this can come in form of heartburn. So not and be clear, heartburn has nothing to do with your heart. So we've also explored other areas like anxiety and stress. So that is why anxiety and unnecessary panic and anxiety can also cause because when you're panicking, you're anxious, you're anxious, your body is working harder than normal, and that becomes very too heavy for the heart to carry, and your muscles begin to tighten, so it cause pain as well. And this pain comes in form of chest pain. So that's why we say the heart is seated in a location where there are other organs like lungs and every other organs, and we have all this emotional pain like anxiety as well. So all these ones I've mentioned causes pain, and the pain is being transmitted to human being in the form of chest pain. So don't forget, if you have a heartburn, it comes in form of chest pain as well. If you have a cardiac related issue that cardiac obviously is the heart, it comes in form of that as well. So if you're having anxiety pain due to anxiety and panic, that also comes in form of chest pain. So chest pain is not a diagnosis; it's what you are experiencing. So when you come and then when you see a physician or a GP and or any health practitioner and you're being assessed from your presenting complaint, which is chest pain, I have chest pain, that's be your presenting complaint. What has brought you to my clinic today? It's a straightforward question that will be asked by your health practitioner. So you say, I have this chest pain. Then in that from that location, from that point, you ask you multiple questions to be able to ascertain, and then they can make a lot of they ask you move right or left or in position to see what makes it better. Do you if you lie your if you lie flat, is it better? And we also advise that some of these pains sometimes positioning can help as well. So you say for example, don't and the time you're eating, your weight, sometimes the diet you're eating, and you like to video. This TikTok inactivity detected in your life, complete verification. This TikTok and they have a lot of big problem, honestly. Which one is inactivity? I dare there's inactivity. And for somebody do TikTok, no, stand up again. I mean, if you are unable to verify, drag the pocket. Oh boy, this thing is a worry, you know it's nothing. Sorry, guys, I'm doing verification. Sorry, I'm doing TikTok verification. They're not going to even let you do this verification. Sorry, I'm trying to do TikTok verification. Not be smart. Not be smart, you know. I know if people do this verification. Just to drag puzzle into my so life not even easy for this life. Now you move. You enter here. Oh my God! Finally, I've done the verification. My God, it's people for TikTok. The life is stressful, honestly. This life is already full of stress. Just going to be stressing people for no reason. Anyway, so guys, let's go back to our this thing. So for those that are joining us, we're talking about chest pain, and then we've just summarized what we are doing. The talking about what chest pain is, the importance of chest pain, and then hi Francis, you're the only one watching on Facebook. Thank you for watching. Thank you for joining. And then, hi, Dr. Abel. Thanks for joining. Very important to know possible causes. Appreciate your consistent effort about our health. Oh, hey, yeah, you're right, Madam. Hi, Mohammed. Thanks for watching. So we're talking about chest pain. So very, very important. When you have chest pain, try not to ignore it. Please try to go through the. If you go back to my video, save the anatomy of the image, anatomy of the human body in your phone. Go through it when you have chest pain. Be able to or any kind of pain you've got. Just try to look at the picture, just do the exact location where that particular thing is, and it can give you an idea. Oh, could it be this or this? In that case, let me go and see my GP. So you don't just take paracetamol necessarily and think paracetamol is going to be solved it. Paracetamol is going to be damaging your liver anyway. So if you overuse of it, it's going to be damaging your organs of the body. So you don't want to put yourself in that kind of vulnerable situation. So that's why it's very, very important. You don't ignore things. What you eat, very, very important. What your weight, because your weight, if you lose weight, you are giving room for healthier living. When they say healthier living, if you're obese, you have multiple comorbidities. By comorbidities, I mean multiple health problems when you're obese. And that is why once you lose weight, you actively lose weight. Actively lose weight, not just losing weight, you lose weight and maintain it. You are letting go so many health issues, a lot of health issues. So that is why it's very, very important you watch your weight, you know what you're eating, and then try as much as you can to make sure you don't ignore red flags. When I mean red flags, your body, when you're having chest pain, you don't just go and drink milk or water and walk away and feel all is right. All is not right. You need to, some of them could be caused by anxiety, I know. So that is why I said in my video, say no to workplace violence, say no place to workplace hostility, say no to workplace harassment, say no to workplace stress. Because the job that you're doing that you feel it's everything is your silver and gold. Don't believe me, you once anything happens to you, you cry, they'll replace you the next day. The IR will just say to send flowers and compensation to your family, and that's it, that's you gone. So why clean yourself over any job? You don't you just why stressing yourself? You don't do that. So that's why you need to look after yourself. Your health is paramount. Any task you are assigned and you feel you cannot do that task, please don't do it. Please do not do it. Just speak up that you know what, I think this is too much for me. I need help. Some people might class you as lazy. Yes, I would rather be classed as lazy than I try to impress people to do things that normally I'm not able to do just to impress people or just to earn promotion or just to earn people saying, oh, praising me, singing praises. Just don't forget, if anything happens to you, these people will move on. And they just need you to physically do the job physically, not because they really, the moment it's something that you don't know even like anyway. Sometimes you need to be very, very wise and very, very cautious, very, very careful about yourself. And it's very, very important. I don't know how best to emphasize, but you don't let things just slide unnecessarily regarding your health. Your health is priority. When you look at things, you dig deep. You don't just sit at the periphery, at the surface level. Oh, think deep. Me, if anything happens to like any of my child, anything happens to you, like one thing, apart from the multiple questions I will ask, which is the history presenting complaint, I look at whatever you've had and then dig deep into it to make sure what could be the causes. I lay out all the causes. Then I try to start on my own, start to rule out the ones that it's not applicable to that. I rule out any few ones that I'm left with. I tell that child, I go to the hospital and I tell the doctor, I think it should be this, or this. So you do your own analysis. So 90 over 100, doctor will come back and say it's one of those things you've mentioned. So that is how attentive you need to be. Very, very attentive to your health and the health of every members of your family. Very, very important. So you can successfully do a lot of treatment at home without going to queue up at the surgery or going to take unnecessary medication. There are a lot of things that you can do, like home remedy wise. So you are able to. So please, like anxiety can play a major role That is the reason why you don't want to create unnecessary emotional attention for yourself. So during a panic attack, now listen, during a panic attack, I'm talking about panic here, not panic attack. So during the panic attack, people often feel as though they cannot get enough air. Some people gasp for breath. Their fingers may tingle, their hearts may race, a sense of impending doom may appear suddenly. Many people experiencing their first panic attack believe they are having a heart attack. So understanding this connection can transform fear into awareness and control. So don't forget, when you have a panic attack, say, for example, somebody just told you, oh, your uncle that just panic, that panic, that panic, your body is working harder than normal to keep your body to that level, that fight and flight mood that you have created. Your body is working more harder, your muscles begin to tighten. At that point in time, you can experience pain, and that pain has something to do with your heart. It has something to do with your cardiac. It's a panic attack that you've just had. It's not heart attack. So you need to you need to really understand the differences and then what has led to this. Oh, somebody just gave me bad news, breaking bad news, and there's someone don't even know how to break bad news. I'll do a video on breaking bad news. When you are looking after a patient and then you notice a diagnosis that you need to pass on to the family, I will do a separate video on how you can comfortably, sympathetically present and be able to pass this information to the family or the next of kin or to the patient as well without creating unnecessary panic. But sometimes when you are being diagnosed with a new diagnosis, the illness doesn't pie you, doesn't drain you. What drains you and makes you to lose weight instantly is the anxiety, the thinking of, all of a sudden you have brought yourself to level zero. You're not thinking about life. Life doesn't mean anything to you. You feel that's the end of the world. So you create those panic attacks for yourself, following the diagnosis you've been told about, and that is why some people they tell them, oh, you are so and so, you are HIV positive. 3 weeks later, when you see them, they are skinny because they are not eating anymore. It's not the HIV that is working. No, it is panic at this, just the emotional stress they have imposed on themselves. That is what is now acting. So when people see them 3 weeks, oh yes, he has HIV. So it's HIV must have kept him in that situation. No, it's not the HIV. It's not. It's the stress that you have created for yourself. So that is why you need to be very, very careful. You need to be very clear what you're doing and then try as best as you can. If you need extra support, always seek for help. Don't do things ignorantly. And then, like I said, information is key. And don't do things ignorantly. Try to make sure anything you're doing, you ask questions if you're sure. Seek for help is allowed. Ask for more training is allowed. And then ask for extra shadow shifts as well if you feel you're not competent in doing a particular skill. Do not do it. Any equipment you're not being used, do not use it. More training. Make sure you're confident and competent in doing anything before you go ahead and do it. So ask multiple questions. There's nothing like silly questions here. Ask multiple questions and keep yourself right. I think that is the best. That's the best way to learn. Always read, always research, and then try to minimize panic and anxiety. Anything you're doing in this life, just know that the worst will always be the worst. Okay? The worst will be somebody has cried. That's the worst. You know? So that's the worst. Because if it's not that, so long as you're still a living being, there's definitely hope for tomorrow. Okay? So try not to panic unnecessarily and create unnecessary anxiety for yourself because you're causing yourself more havoc than good. You're not helping yourself at all. So very, very important you keep yourself up to date with relevant policies and procedures and make sure you are keeping yourself right. So also, hi Ian, thanks for watching. Ezinne, thanks for watching as well. Mohammed, thanks for watching. So another thing I need to clarify here: when someone arrives at the hospital with chest pain, Doctors begin a careful investigation. Say, for example, if you come to my clinic and you're presented with a chest pain, the first thing I would do is hand hygiene, obviously infection control. The second thing I would do is to introduce myself to you. Hi, I'm this, and you've what's your name? I will get your details as well. You've told me, then I will seek consent. Very, very important. So pre and post examination must be thorough. Then the actual examination is when I will say to you, you have come, what brings you to my clinic? Then you tell me you've got chest pain. Then I'll start with my history presenting complaint. If I want to use any acronyms to go through the process, I will. I will if I want to. So people do it differently. So now, when someone arrives at a hospital with chest pain, doctors begin with a careful examination. They listen to the story of the pain. Listen, when did it start? What does it feel like? What makes it better or worse? They perform tests that looks at the heart's electrical system or activity. Like they check your radial pulse and your brachial pulse, and they want to see if it's regular. They want to see the volume, and then they want to, if you're having pain in your sternum, they want to further do maybe an ECG to check if your heart rhythms are regular or irregular. So these are the things, electrolytes. They want to make sure that they rule out as many things that they can rule out. So you have few differential diagnosis that you can focus on, you know. So that is why it's very, very important. You are very honest. Don't exaggerate things. Don't undersay anything. Just say it the way it is. When you're being asked questions as well regarding your health, very, very important. Don't think you're bothering anybody. You're not bothering anybody. You just say it the way you're feeling the pain. If you're expressing a pain in your chest, say it the way it is. So the reason why they perform electrical activities is because they perform tests that looks at the heart electrical system, checks for markers of heart damage in the blood, and create images of the chest to see what lies beneath the surface. Okay, these tests are not performed to create fear, but to create certainty. So when you're being asked that, oh, come back tomorrow. Say for example, you've been seen today. In most developed countries, if you have a chest pain on your sternum that radiates to any part of your shoulder blades, regardless, you'll be referred for an ECG. Even on a ward level as well, even as on a ward level as a nurse, your patient is complaining about chest pain. Before you go and get the medical team involved, you need to make sure you do all these things. You check the vital signs, check the vital signs, go for get ECG done, do reposition your patient. If your patient is lying flat, reposition your patient properly, maybe the 45 degrees. You do other things so that when you're going to meet the medical team, they will also ask you, what have you done? Your patient has complained about chest pain. What have you done? You've literally done nothing, and you're asking the medical team to come and support you. So, what have you done yourself in the ward before you need help? So, there are a lot of things you can do at that ward level and be able to provide solution. And then you get the doctors in to come and do their review. So very, very important. You try to make sure you get as much clue as possible. So these tests are not performed to create fears. Say, for example, somebody would say, well, I want you to go and I want to do your ECG, or I want you to go for chest X-ray. Do not panic. You understand? I would rather I just go and come back and get to the worst result than I refuse to go. Then 4 years down the line, I've got a damaged heart that is irreversible. So I would rather go for that X-ray to find out what the problem is. And if I go, there's nothing. You'll be told there's no, and if there's something, if it's being diagnosed at an early stage, then you have the chances of treatment working rather than leaving it till very late when you know the chances of treatment may not work. And that's where DNA CPR comes in place. In the case of heart attack, do you want to be resuscitated? No, because obviously the damage that's going to cause to the benefit of bringing you back to life in the case of um, bringing you back to life, the benefits or the, I don't know how to even put it. So DNA CPR is simply a way of means do not attempt resuscitation. So if I'm going to resuscitate a 99-year-old lady, you and I know that clinically it is not going to be in our best interest. Well, if she's got consent, if she's got capacity at age 99 and she wants to be resuscitated, fine, go ahead. But can imagine a 99-year-old lady giving consent because she's got capacity, obviously, she shouldn't be at that age anyway, but if she does, which is fine, and she's giving consent to be resuscitated in case of, and she is being resuscitated. You can imagine the damage that will be caused is worse, way, way worse than the benefit of keeping her alive at that age 99. So those are the clinical factors that will be looked at before they have that conversation, as in a round conversation, not just with her once, but with the next of kin as well, with the next of kin if need be, and not just one single conversation, maybe two or three conversations before they finally agree at a solution on what to put in place for this particular patient or not. So, like I said, don't create unnecessary fear for yourself. It is not really, really important. It is not important. So, you also need to understand that knowledge is powerful because it gives people the ability to act, and that is true. And information is key because without information, the world will not be globalized the way it has been. And prevention plays a major role in reducing heart-related chest pain. Regular physical activity strengthens the heart. A balanced diet protects blood vessels. Controlling blood pressure, managing diabetes, avoiding smoking, and reducing stress all protects the heart long before symptoms appear. Don't forget, I'm going to repeat myself again. Like I said, knowledge is powerful because it gives people the ability to act. Information is key because without information, the world would not be globalized as it is just now. Prevention plays a major role in reducing heart-related chest pain. Regular physical activities strengthens the heart. That's why it's good for you to exercise. A balanced diet protects blood vessel. So replacing your junk food with fiber food or protein food makes goes a long way in protecting your heart, and also controlling blood pressure, managing diabetes, and then avoiding smoking and reducing unnecessary stress all protects the heart to live long before any symptoms appear. So if you're out there and you're still wondering what do I do to protect my heart, please go and start doing exercise. However little it is, just make it consistent. Don't just do it today because I've said so. Just continuously put it in your routine when to do exercise, when you want to do exercise, and then control your blood pressure. Very, very important. And then manage your diabetes, whether you are pre-diabetic or you're actually diabetic, whether Omotola is watching. Thanks for watching. So whether you're diabetic or pre-diabetic, you need to understand that you need to control your diet. Some people are diet control, which is good. You need to watch what you're eating. You need to not wait until they chase you, your parents will chase you or scream their voice out before you know that you stop eating white bread. No. If you don't like white bread, there are some brown bread that are good, whole bread that are good that you can actually take the edges off. When you take the edges off, the middle of the bread is quite soft. It's a lot of waste. But I'd rather I buy it and waste the edges. At least I'm eating something very soft. You will still like it. We have brown diabetic rice as well. So rather than go for the white rice, you can go for the brown rice. You can change your entire life pattern, lifestyle comfortably without like missing any meal. The major thing is you're not eating red meat, you're eating you're eating your fish, you're eating your protein-based meals, you're replacing fiber with junk meals. So all these things helps you, and avoiding smoking. I've done a video about smoking, what the smoking does to the human body, the lungs, and the after effect of long time smoking. Then if you go and watch that video, it's very short. It's a 2 minutes video. It tells you systematically in less than 2 minutes what smoking does to the human body. So, is anybody there? Okay, that's the delivery guy. So, very important. And reduce stress, like I said, try to reduce stress. If having multiple friends is going to cause you stress, then minimize your friends. If having toxic relationship is going to cause you stress, then reduce it. If your workload at work is too stressful, then speak out. You're not making drama because you like drama, no, but you're rather protecting your health. Because the last thing anybody wants is to be stressed unnecessarily. You want your days off. You want to stay in your house comfortably. You want to do your thing. You don't want any problem with anybody. You want to just mind your business. You want to be happy. I think it's very, very important we all choose happiness over everything. In as much as we all need money. Joseph, are you there? Oh, I was just hearing noise. I wasn't sure who was that. I thought that was a delivery guy. What are you doing? You don't do nothing. All right, good boy. So it's very, very important to just look after yourself. Very, very important. Just self-awareness. Gonna back in the days, I really don't really care about myself. A lot of people will say, "Oh, she doesn't like to dress. She doesn't know how to dress. She doesn't care." I really, everybody's not the same. I'm not a fashionable person, so there are certain we can't just change them. I may have the money to go to the market, and you will have the same money to go to the market. The things you will buy might look more classier than what I will buy. I will just go to the market with you. I'll go and buy Mary and Amaka things with the same money that you have spent to buy classic things. So people are different. So you try to improve, but then you can't be somebody else. You have to just be who you are. So just remain true to yourself, remain real to yourself, take negative and positive feedback seriously, but then most importantly, self-love. Don't wait until anybody come and tell you that they love you. No, you have to love yourself first, regardless. Whether you're educated, whether you're a pauper, whether you don't have, whether you have there's for you to eat or not, you need to love yourself. Look at yourself in the mirror and tell yourself, you know what, you love yourself. You know, if you give yourself that first love, that self-love, nobody can come around you. That you will never experience low self-esteem. The reason you will not experience it because when you love yourself so dearly that you don't joke with yourself. And for people that don't joke with themselves, you can't see them making unnecessary friends. But then they make a friendship that is not working, they've moved on. You won't find them in that location, they've moved on, because they value themselves, they value respect. They just give themselves that space, to make sure they don't clash with people, they just mind their business. It's very, very important. Above all, look after your health. Small daily choices create long-term outcome. A walk taken today, a healthier meal chosen tomorrow, a secret avoided, a night of good sleep. These actions seem small, but they accumulate into powerful protections. So for those that said that doing long hours, hi Giant Room, thanks for joining. For those that are doing longer hours because you've got immigration bills to pay, you've got a lot of things to do, you are just stressing yourself. You are just stressing yourself. There's absolutely no need. Honestly, you absolutely no need. Just do what you can do. Your direct debit is bounced, let it bounce. You understand? If you don't have money to pay, then don't pay. I'm not saying you don't. I'm not saying don't stress about anything. If you don't have money to pay, call the merchant, call the supplier or whatever the seller. You know what? I know I'm owing you 200 naira, but I don't have it now. Please, I'm sorry. Give me 2 months. In the low countries, when you speak out like that, they will give you time to pay. You're not running away. So don't stress about anything. You've not got money to pay your children's school fees. Don't pay it. Just go to the school, speak to them. I know some schools under developed countries, they don't listen. Once your child has not paid school fees, they throw you out. In developed countries, we don't pay school fees. So your kids go to school for free. So we are very fortunate. You understand? So it's really, really hard to balance based on the part of the world you're from. But then don't stress about anything. If you're struggling, you're in developed countries, you don't have food to eat, feel free, get in touch with relevant authorities, tell them your situation, they'll provide meal for you. I've never seen anywhere where people don't have food to eat and they have to die because of the lack of starvation. No, because you chose to serve. So speak out, seek for help, seek for support. All these things are made available. So just don't just panic and give yourself unnecessary stress in the house and develop a health condition in the form of chest pain because you're anxious, you're having panic attacks about what will my kids eat tomorrow? Oh, tomorrow is Christmas. Oh, next month is Christmas. I don't have things, and so try not to panic. Very very important. Panic attack. It's something that is created by yourself. It's not heart attack. Very clear. Panic attack is caused by yourself. So that is why there's absolutely no need for that. Anxiety is created by yourself. Stress can be created by yourself. And if it's created at by if it's not created by yourself, then you can always speak out as well that you know what, I think I'm getting stressed here. This tax is too much for me. I'm not going to continue with this. So in that situation, please, 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 you have every lot of everything to say your say your mind to make sure you live freely. Like I said, small habits and choices that you create today can go a long way to save your heart tomorrow. Chest pain is not the enemy. Don't forget, chest pain is just a messenger to tell you something around the organs seated around that heart location is telling you that there's a pain which could be caused by anxiety or panic attack, which is caused by yourself because you worry so much. You worry about this. You worry about your kids' clothing. You worry about your kids' outfit. You worry about your friend is driving a Range Rover. You want to drive Range Rover. You worry about the next party to attend and all the ashibis to do. You worry about food. You worry about competition. You worry about the latest phone to buy. Oh my God. You worry about so many things about this life. And then you create unnecessary stress for yourself, unnecessary tension for yourself, panic attack. So that can cause chest pain as well. So don't see that kind of pain as heart cardiac related pain, heart related pain. No, that one is caused by yourself. So if you want to remain fine, the choice is yours. For some reason, Instagram doesn't show people's life to the audience. Instagram just do what they want to do. Honestly, they just don't. They've been telling me for the past 1 hour. We are telling your followers that you have started a live video. Can you imagine? Just I can see you crawling. I can see you crawling. So we are going to summarize, guys, quickly now by saying that please, chest pain is not the enemy, it is just a messenger. Sometimes the message is urgent and demands immediate action, please. Sometimes the message is gentle and asks for lifestyle changes, like I told you about the anxiety and panic attack. You need to change that. Like the issue about the heartburn can also cause chest pain. Heartburn because when you eat beans, some people when they eat some like all these lime related meals, they have that heartburn. Some people they eat. So you know what you eat that causes you that. Do you eat spicy meal? Some people they eat spicy meal and they get it, you know. So rather than taking Gaviscon all the time, you can actually avoid that meal or prepare that meal in a different way. So you don't have like me. I prepare the beans in a different way. I add plantain in it. I add vegetable into the beans. I add plantain and vegetable into the beans. And I don't make it too spicy. Then I try to eat it through the day so that I've got plenty of time for it to digest before nightfall. So you can actually change it to be lunch rather than making it dinner. Dinner, if you take it at 6 p.m., 7 p.m., and you're going to sleep at 8 o'clock, 1 hour is not enough time for you to for the food to have digested, you know. So you are literally eating and going to lie down there. So you are causing more problems for yourself. So these are lifestyle changes that you can literally do for yourself without high comfort aqua. Thanks for joining. Join from your post. Hi, I love your name, darling. So literally, that's what you can do for yourself. So sometimes, like I said, the chest pain is a messenger, and the message is gentle and asks for lifestyle changes. Sometimes the message comes from the mind asking for rest and calm. For those that are working long hours, this is for you. I've done a video about work-related stress, how to reduce stress. Please, this video is for you. If you're the type that is going from work to work, you're working long hours because you have immigration restrictions or because you have like families, you have people to feed back home in Africa, you have to build mansions in Africa. This video is for you. Please, vanity upon vanity. I'm not. It's good to invest. Invest wisely. Invest and look after your health. Don't go and take your life savings to go and invest. Wow. Thanks for joining, Kumar. Thanks for joining. I've just called out Instagram and they've just showed my video to you guys. Oh my God, Instagram, they're just being politics. So thanks for joining. So we're just talking about chest pain and we're just rounding up, guys. In our 30 minutes now, that's the max time we can go on live, but I need to go on live as well on TikTok so I can have my other community as well. So I need to end this live shortly. So, like I said, we are talking about chest pain, guys. For those that are just joining us just now, we're talking about chest pain. what causes the causes of chest pain and the treatment for chest pain. So we made it clear that chest pain could be caused by different factors, like it could be cardiac related, which has to do with your heart. It could cause by caused by the lungs. Then also the esophagus, the pipe that carries food from your mouth to your stomach, lies just behind the heart as well. If you go through the anatomy of the human body that I posted 2 days ago, if you go through, you can see where the heart is lying, and you see where the esophagus is lying, just right behind the heart. So there's a reflux. If reflux goes backward, automatically it causes sensation and it causes sensational burning, and this burning comes in the form of heartburn. So that heartburn also is being reflected to human being as chest pain. So this chest pain, obviously you are seeing chest pain, but it's not cardiac related. Don't forget, heartburn has something to do with your heart. Your heart is still perfect. Heartburn is just because of the reflux, backward flow reflux into back into the esophagus and has caused them all these sensational burnings. So you are still okay, but all you need to do is to make sure you watch certain things like watch your weight, your diet, what kind of meal you are having, the time you're eating the meal, what health issues do you have, and how you're managing it, and most importantly, lifestyle can resolve all this. So, having said that, guys, it's very important to say sometimes the message comes from the mind asking you to rest. So, this one, or to calm down when things happen. Say, for example, you've had a bad news broken to you need to calm down. It is hard, for people that go through a lot of um, um, bad news. When somebody is being diagnosed of something and you're being told, your heart pumps, your heart, come into that fight or flight mood, and all of a sudden the heart begins to work harder, your heart is working harder than normal. It needs more oxygen, it needs more blood flow, it needs more everything to keep you to that level. And normally, I know it's natural to panic, but then you can as well avoid all this drama by remaining calm. Just have a cold drink, process the information that's been given to you, take a walk, just be quiet in your if it requires you crying, just be quiet, please. Cry terribly, cry properly, take a cold drink and come back and accept reality, and move on. Because in life, sometimes we need to accept reality. What has happened has happened. It's not reversible. It's hot. It hurts. But then, while it hurts, and we appreciate the fact that it's a very sad moment for everybody involved, at the same time, you need to understand that you also have a life to protect. The life you have to protect is by how do you protect your life by remaining calm in that situation. It's really hard to say calm, remain calm, but I think that's the only remedy in that situation. Just remain calm. Just have a rest. If it needs to put your phone on silence, go and sleep. Get something to eat, drink. If you're having any sore head, you won't take any pain relief, it's fine. But go and sleep. By the time you wake up, you'll be refreshed. The problem is still there by the time you wake up, but then you feel a lot better. You feel that's why when you're upset, you're angry, don't make decision at that time. I have been in situations where I've been upset and I made decisions. I've been upset terribly. I had to come and do live video that later on when I watched the video, I said I shouldn't have done this. Oh, I shouldn't have done that. I had to start to apologize. So that's why when you're upset, try not to speak in that instance. Try not to come and defend yourself. Try not to say anything. Try to let your head cool down. Let the anger subside. Forget about it. Maybe give days or weeks or even months. Then come and speak at it on a good day. You are more calm. I think that's the maturity and the beauty of forgiveness. So try not to. So finally, we'll round up this section by simply saying the most important lesson is not to ignore the message when your body gives you a signal, please. So if you didn't learn anything from this live section about chest pain, causes of chest pain, and the treatment for chest pain, please learn one thing. And that thing you should learn is the most important section is not to ignore the message. Listening to the body is an act of respect and self-care. Care about yourself, care about your body. You have to listen to every signal your body tells you. Very, very important. The heart beats more than 100 times every day, asking for attention. So when it finally does ask for attention, the least we can do is to listen and act immediately. I hope this live section does make sense. And if you're coming across my channel for the first time, this is Christmas Investment. Kindly like, share, and subscribe to all our channel. And I will see you in my next week, Saturday's live section. And that section, we're going to be talking about wound management. So we're going to tell you the types of wound, what are the grades of wound, how to use the roper ladder to assess your wound, and then not just that, to be able to what are primary and secondary dressings, and then what dressings to use if you have a necrotic black heel. What do you do? Does it need to be covered up? Does it not need to be covered up? When you have a blister, what do you do with the blister? Do you need to cover it up, or do you not dress it? So if you have a skin tear, what type of what grade of skin tear is that? If you have a pressure, also how to protect your vulnerable areas for your parents that are aged, that are not mobile, how to protect their pressure areas as well and their sacral areas, and then cleansing. Very, very important. So we will be talking about wound management in our week section. Okay, thank you so much for watching, and then all the best. I will see you next week. Bye. So I'm going to switch over to Chris. Yeah, just have. Chris, is she sleeping? Is she awake? Do you want to check? Do you want to just check, please? Sorry?